Chloride is the most abundant anion in extracellular fluid, with a normal range of 97 to 107 milliequivalents per liter. So while it's important to understand chloride and its function within the body, it's not as essential as the measurement of other electrolytes like sodium and potassium. And generally, chloride levels aren't really looked at or interpreted apart from sodium, potassium, carbon dioxide, and your overall anion gap. So let's talk a little bit about what it is and why it's very important. Like I said, it's the most abundant anion in our extracellular fluid. Its most important function is really in the maintenance of acid-base balance because it competes with bicarb for sodium. Along with this, it also plays a very important role with sodium in the balance of maintenance of water balance and aids in the regulation of osmotic pressure. So it really plays a really important role in conjunction with sodium because remember, it's competing for this sodium in the balance of fluid and osmosis through our vessels. And then it also plays a role in competition for sodium with bicarb, and because of that, it really plays a role in acid-base balance. Another function of chloride in our body is that it contributes to gastric acid, hydrochloric acid. And because of this, it helps in the digestion and activation of different enzymes in our body. Most of the chloride in our body comes through our diet, through sodium chloride or salt. So that's really how we get most of the chloride in our body. The excess chloride that we intake is actually excreted via the urine. The chloride that is used is filtered out in the kidneys and then reabsorbed in the renal tubules. And so that's where we get the chloride that we're going to then use in our body. So it's not often that a provider is going to order just a chloride level. Chloride is generally included as part of a panel with other electrolytes. Your sodium, your potassium, your chloride, and all these are going to be run together. The indications for this and the indication to look at chloride is, like we said, generally looked at in combination with everything else and can be helpful in assessing an anion gap. So one of the reasons we're going to run this is to confirm a diagnosis or to differentiate between different types of acidosis, whether it's hyperchloremic acidosis versus an anion gap acidosis. It may also be looked at to evaluate if therapy is effective if we're trying to raise a chloride level or lower chloride level. So some of the reasons we're going to see elevated chloride levels are going to be in issues like dehydration, diabetes insipidus, where we're flushing out all of our fluids, and so we're going to have a higher concentration of our electrolytes. You may also see it with excessive infusion of normal saline. Remember, normal saline is going to have some chloride with it, and so we're going to see the elevated levels of chloride. Acid-base imbalances that we're going to see elevated chloride levels with are going to be metabolic acidosis, and that's going to usually be manifested with excessive diarrhea. And then we'll also see it with respiratory alkalosis, and you'll generally see that in your patient through hyperventilation. Some of the reasons you're going to see a decreased chloride level would be issues, let's talk acid-base imbalances. First of all, you would see it with metabolic alkalosis or respiratory acidosis. You could also see decreased chloride levels with overhydration, excessive sweating, congestive heart failure. So these conditions where we're either diluting the system or we're losing chloride, okay? And we'll lose chloride through sweating. Critical chloride levels are going to be less than 80 or greater than 115. And we're really going to want to watch our patients for this. And a lot of times, like we said, you'll generally notice this on your routine labs. You'll be running your routine labs and you'll see chloride is lower, or your patient might be having an acid-base imbalance. And so you'll be aware that there's issues with our chloride level. And so you'll start to see the signs and symptoms of hyperchloremia would be weakness, lethargy, rapid breathing, and signs of hypochloremia would be twitching and tremors, okay? So that's how you would see it. Remember, our normal range for chloride is going to be 97 to 107.
Thank you for listening to our podcast today. Nursing.com is the trusted learning hub of all future nurses, your secret weapon for passing nursing school with your sanity intact. We want to invite all our listeners to visit us online and take advantage of a special promo offer. Just head over to nursing.com/free. That's nursing.com/FREE, and check out the free resources and other goodies that we have there just for our podcast listeners. Until next time, go out and be your best self today. And as always, happy nursing.